again for joining us today, and we're so pleased to be working with our partners at Lakeland Regional Health and the Florida Department of Health to bring this opportunity for a roundtable discussion with you today. Our format will include a bit of a presentation by both Dr. Jackson and Dr. Haight, followed by, and thank you all for submitting your questions ahead of time. We'll be addressing them, and then during the course of today's time together, please feel free to use that chat box for your questions. The next slide just goes through some housekeeping matters, which would include being mindful that this is being recorded. So if you do miss any portion of it, it will be readily available for reference through Polk Vision, as well as the Lakeland Regional Health reference library that they have on their website. And in order for us to make certain that we're free of distraction, if you will please keep yourselves on mute. And if you do, all of us have Zoomed so much, but for those that are not familiar, you can submit your questions via chat. And we're suggesting that you submit them to the Polk Vision facilitator, which is Kirsten. She'll be making certain that we get to all of your questions today. And then just finally, just be mindful that the information that we're sharing with you today is based upon the best available information we have as of today in the now normal, right? And as things evolve and as science becomes more clear to our experts, they will be continuing to offer themselves for local advice and sessions such as this in the very near future. So with that, I'm going to turn it over to Lauren Springfield with Lakeland Regional Health.
Good morning, everyone. My name is Lauren Springfield. For those of you who don't know me, I am the manager of community health at Lakeland Regional Health, and I thank you all for being here. We decided to partner with the Department of Health and Polk Vision to create this session just so that as we have been in the community talking to our local colleges and universities and other higher education learning facilities, that we could really spark some discussion as we're all talking about and navigating through a lot of the same things. And so we are so grateful for Dr. Jackson and Dr. Haight and everything that they have been doing in our community during this time. And so we're just gonna jump into things and go ahead and get started. And Dr. Jackson is going to lead us with a Polk overview, and then Dr. Haight will come in and he will give us some best practices as well as start answering some of the questions that you've posed.
Good morning. My name is Joy Jackson. I think I've actually probably spoken with several of you all as you have begun your planning for potentially reopening your colleges and universities in the fall. I'd like to give you sort of a brief overview of where Polk County is now in the COVID pandemic. We're now about 10 weeks into our first case in Polk County. This is a snapshot from the DOH dashboard, and this was actually from about 2 days ago. And actually currently we're a little over 900 positive cases in Polk, which sounds like an awful lot, but it represents about 0.1% of our population. On the other hand, is this everyone that's been infected? The answer is no. There have been some difficulties with people getting tested that are symptomatic and some changing guidelines over time as to whether those that are young and healthy even needed to be tested. But at least it's a snapshot of where we have been and come in the past 10 weeks. On this slide, you will see on the upper left are cases by race. You'll see that we have a slight predominance of females, which I'm attributing to the fact that a fair number of our cases, over 200, have been of residents of long-term care facilities. Our median age from the beginning is around 53. And then on the bottom bar graph, you'll see the number of new cases by residents by day. So as you can see that sawtooth bar graph on the bottom, we are still developing new cases. You can go to the next slide, Kirsten. This is another dashboard, and this is also available publicly. Some of you may have found it, but for those of you that haven't, if you go to the Florida Department of Health website, there's a big banner in the middle that says COVID. You click on that and scroll to the bottom, and there's a dashboard. And then within the dashboard, you can get to county-specific data. And this is one of the internal documents within this. And this is a community surveillance dashboard. And these are some of the key metrics we're looking at to help determine where Polk is in this pandemic. To me, one of the most important is in the upper right, the documented new cases. So on the prior page, we looked at daily cases. This smooths it somewhat, looking at the number per week. The most recent data point on the right is from around May the 20th, I believe, and that was 120 cases. So over the past 4 weeks, we are remaining relatively stable and adding 100 to 120 new cases of COVID weekly. On the bottom right, it shows our percent positive of all laboratory tests done in Polk. The good news, and I don't have it, I think, on this particular slide, but we've done around 19,000 individual tests in Polk County, which is more than 2% of our population. And we're doing enough testing that we are having fewer and fewer positives. And that is actually a healthy indicator that our percent positive is under 10% and actually is just a little bit over 2%. On the left, those two line graphs are looking at syndromic surveillance. So our epi staff can go in and look at cases that are coming to the emergency department. So we can look at emergency department visits for people that have flu-like illness and for those that have COVID-like illness. And this is like an early warning sign to see if we're going to potentially get more cases that are diagnosed. So just as a put it in perspective, somebody that develops COVID may have symptoms for a few days before they go and get tested. It then will take 2 to 4 days to get reported, and then about a day to show up in the Department of Health database. So the syndromic surveillance is very important, again, as an early warning method. And certainly my epi staff will be looking over the next week or so to see if we have any increase related to the Memorial Day holiday. Okay, if you go to the next slide. All right, so I want to just briefly, again, I have spoken with several of you as you have begun your plans, how critically important it is for institutions of higher education to be planning and preparing. Lakeland Regional and myself, either as a group with you or individually, are happy to work with you, but the planning phase is very important. Really in the face of changing local conditions regarding our COVID level of activity. What are we going to look like in Polk in August? Again, we're watching on a daily and weekly basis, but I do expect to have further conversations with you about our level of activity because that does impact your planning. There are changing guidance and updates from experts like the Centers for Disease Control, and then also updated guidance that come from your governing authorities, such as the State University Board of Governors, I believe is actually meeting today to consider and potentially approve the Florida blueprint for reopening campuses. Now, those of you that are state colleges and universities, I'm sure are waiting with bated breath for that document, and those that have private colleges may be interested to see what the state is going to do. And then also, I think we also watch as new knowledge is gained and best practices are being identified in other institutions of higher education around the country. Next slide, please. So I hope I'm not over speaking this because I think that probably most of you are already well on the way with this. And I hope that you have already established or will very soon an internal team for planning, execution of your plan, and for monitoring going forward. I would and really, you know, we're looking at the short, medium, and long term. This is not going to go away in the next few months. And your plan needs to look at getting started, then the medium term, and then the long term is we may be dealing with things until hopefully there's a vaccine that's effective. I would strongly recommend that you identify a COVID-19 point of contact, and everyone on your campus should know who that person is. You need somebody that a student or a faculty member or the college president can contact that is a really important point of contact. We also need to hope for the best, but plan for the worst. The best case scenario is you don't have any COVID on your campus, but this is highly unlikely. The worst scenario is multiple outbreaks. But within your plans, you need to identify if an individual case or an outbreak occurs, don't view this as failure. We learn, adjust, and we go forward and realize you're not in it alone. Realize that COVID-19 is a sneaky little booger. None of us want to contract this, but we have to deal with it and go forward. And our goal is to recognize cases, isolate individuals, contact trace, and contain the spread. Next slide, please. So each of you is a different institution, but components of your plan will be similar. You have different size, you have different things that you offer. You certainly have different physical layouts of your facilities. You have different things that you do from the standpoint of sports, Greek society, extracurricular activities, whether you are whether you provide housing or whether you're strictly commuting, whether you have a combination. So the planning will be unique to your institution, but the key components that you need to have in a written plan and that you and your teams discuss are preventive measures to start with. Will you conduct health screenings? Does that involve testing? How will you promote social distancing? How will you promote personal hygiene with your students, your faculty, and staff? Will you have availability? Not will you, but how will you have availability of things like hand sanitizer and masks? Will you enforce masks? Having signage and communication to promote healthy behaviors on everyone's part. Environmental cleaning for routine cleaning, and then how do you address cleaning if you have a case or an outbreak? Student housing considerations. Will you have, will your student housing in dorm rooms have multiple students, or will you back off and have one student per room? How will you handle meals? Buffets probably should be discouraged. Box meals will be preferred, particularly during this time where I view that Polk has a medium amount of transmission. And then importantly, how will you protect your vulnerable populations based on age and or medical conditions? Next slide. And then communication and setting expectations for your students, your faculty, and staff. You cannot over communicate with signage, with emails, with text messaging, all those smart ways you keep your students, faculty, and staff informed. And then how do you respond to a possible case? And the first thing to do is to isolate that case. You need to figure out within the confines of your campus, is that isolation going to be at home for that student? Or if it's a dorm student, how you're going to accomplish that? How are you going to have that student evaluated and tested? Some students may be tested and may not share that with you. That will be a challenge you will have. And then contact tracing. The county health department is ready, willing, and able to assist you when cases are identified. We may be the first to know. We may get notified of a positive case. We notified the case, and lo and behold, we find out it's a student. We have to protect HIPAA, but we also need to protect the public health. So those conversations we will need to have with you. And very importantly, we need to work with you to identify close contacts. So it will be important for you to help us identify students, faculty, and staff who may have been in a classroom. So if you want to have a sign-in sheet for every class, ideally we would know class rosters, who attended, because if we identify that a student was in class last Wednesday, Thursday, and Friday, and they were in these classes, we need to know which students were physically present in those classes so we can reach out to them. Ideally, we would need to know where they sat, but at least know who was there. Perhaps somebody was actually out and we're not there. We need to know that if possible. That will really save us a lot of time and effort to really be able to identify those students. Other considerations you need to have in your plan are international students and study abroad, activities you do from the standpoint of sports, Greek life, and other activities. And then also importantly, and I'm assuming Dr. Haight will speak to this, we're going to be approaching flu season, and we really need to strongly recommend flu vaccination to our students and our staff. Next slide. So view us at the health department as a resource for you. I didn't put my cell phone on here, but I'm happy to share it with you. This is my email address. The DOH Polk EPI number is on that as well. The CDC guidance for colleges and universities, in my opinion, is a critical document that will help provide a framework, as well as from the Florida universities, the blueprint for reopening. So that's all of my prepared comments. I know that there's some questions that have come in, so I will turn it over to Lauren, and then we will go forward, and I'll be happy to answer questions at the end. Thank you.
I think Dr. Haight, you can go ahead with your presentation.
And Dr. Jackson, can you hear me okay?
Yes, sir.
Okay, thanks. I can see you nod your head. Okay, perfect. You know, a couple of things that just quickly update you on our current status right now. In the hospital, we have 72 patients that are positive for COVID and 22 that are pending the test, pending the results, and 2 of them on a ventilator. That often means that we have a lot of stable patients that are recovering actually from the illness, and many of them from long-term care facilities like nursing homes and skilled nursing facilities, and pretty much just waiting to find the best place to finish their recovery. We'll be watching this closely, you know, as time goes on. As Dr. Jackson mentioned, that's important things to keep in mind of. There we go. So a couple of things we want to cover. I'll actually start with what we're not going to cover, the things that you're probably very familiar with, the symptoms, the incubation periods, things that you've already heard a lot about, so we won't spend too much time on that, but please ask questions and contact us if there's an aspect of this disease that you're hearing frequently from medical experts and others, and you keep hearing the same term and you really want to get a better definition of it, and what you're finding on the internet's not quite doing the job. It often really is beneficial just to have a conversation with someone that can either answer the question or find out the answer, and then we're here to make sure we can get those answers, because we want to take whatever knowledge you have now and just add to it, but also make each and every one of you great educators on this particular topic. So, you know, a couple of things that you're doing right now is you're leading by example. You know, when you may be sanitizing your hands and doing all these things, but when you do it in front of other people, people see that you're taking it seriously, you're leading by example. And as Dr. Jackson mentioned, having a person that has, maybe depending on the size of your organization, an entire team, but having a trusted person that is not just that point person, but the person you trust to be following this every day. And by following it every day, an understanding of what's going on in social media, what is the news media saying on each day, what are the new advances, what are the new surprises, what are the new problems. And so they're keeping their fingers on the pulse of this issue. Make sure that person you know, has the resources and time to be following this each day so they can alert the leadership of developing events. Another thing they would keep an eye on would be local hospital capacity. You know, as you're dealing with your population, you need to know whether resources are being stretched in your community, because you may be wanting to access those services if your students become ill. And knowing the capacity being saturated or not helps you decide on what your daily business plan and education plan is going to be. Also, they'll be keeping an eye on hotspots in the community, what's going on with local businesses, and some of the campus statistics on attendance and what's the buzz out there is going to be important. Now, they'll be following the websites like the Centers for Disease Control and the Florida Department of Health to really get that kind of information daily. I do want to touch base on some basics that have been challenging to understand, but as we go forward in these common questions of should we be testing students, what kind of tests should we be using, let me make sure we all understand the terms out there. The most common test when you hear I got tested, what they've been referring to is a specific test up till now, but it is changing. There are other options out there. But the most common one that we've been using is called a polymerase chain reaction test, PCR. This is a test that is specifically looking for the genetic material of the virus. And in this diagram, I show the virus here, and the virus has the genetic material on the inside. These are the instructions that take over part of your body to tell your body to make millions and millions of copies of this virus to propagate the infection. And this test takes a little fragment of this genetic material and amplifies it so the machine can recognize that it's there. Now, there are other tests that are out there that are looking for other pieces of the virus, and those are called antigens. And it may be that they're looking for little proteins or little parts of the virus. And if they find it and you match it with how the person is feeling, you can be on the confident side that if the test is positive and they have all the symptoms, or if they've had been exposed, they are likely, you can make that confirmed diagnosis. Then we're also seeing the antibody tests, which I'll get to in a moment. So let me specifically make sure we understand this PCR testing that's so common and these antigen tests. When you do that test, it's only telling you what's happening at that second that the swab is placed into the nose and the sample is collected. Now, as Dr. Jackson mentioned, it takes time. Some of these tests can take days to get the results back. It depends on the access to the type of testing that you're using, because there's different testing available for this PCR testing and this antigen testing. But what's problematic is when you make the test, your result is only going to be what was happening at that time. Literally a few hours later, the person could be developing the illness and becoming positive. So they could be negative and then later on be positive. So the test has that kind of problem. The test, depending on how the sample was collected, could turn out negative in a false way. It might have missed the germ that was really there. Also, we have discovered that after a person gets sick and the virus has been coming out of them and infecting others, after they get better and they're recovered and they feel great and the disease is pretty much gone, they can still secrete fragments of the virus. And remember, this test is amplifying just a little piece of this virus, and it may not even be infectious. So the result could turn out positive because it's picking up a little piece of the virus, but the person may not be excreting whole infectious virus. This is very problematic because there is no available test that can confirm this. So I'll get to that later, but that's going to be one of the problems with this test is you can say, is this person contagious? Well, we can have false negative tests and we can have false positive tests. And so that can be an issue. And then when somebody goes out and they get tested and they say, well, I was tested negative, is that really a false sense of security? And is their behavior going to change in a way that raises the risk for the situation of spreading this disease? Now, we also are hearing a little bit about these antibody tests. So whenever you're infected with a germ, your immune system recognizes it as a foreign issue and starts producing proteins called antibodies to fight it. And these proteins will stick to the outside of the virus and the different parts and bind it up and help the rest of your immune system recognize this virus and try to get rid of it. They're still trying to understand how effective our immune systems are in that process. What I just described sometimes works great for certain germs, and sometimes it doesn't work at all for other germs. They're hoping that your body with COVID is making antibodies that will not only help you fight the virus, in fact, we're even using that as a treatment, using antibodies from other people and giving it to sick people. We're also hoping that it keeps you from getting infected again. But we don't know that for sure yet. But there is testing out there. There's a variety of testing out there, and it can test for antibodies. And if you're positive for antibodies, we'll have to wait and see if that's a reassuring thing to tell you you're less chance of getting infected again. Also, we don't know if that's true, how long is it going to protect you? Are you protected for life or what have you? And this is also tied into the vaccine that we hopefully will develop. The vaccine is trying to get your body to make antibodies before you even get infected, so you're ready for the germ when it does get exposed to you. So again, we can handle some questions later and move on. So the issue, I guess, with universities, colleges, is that you've got two functions going on right there in front of you. You have both the actual students that were, trying to get the students to get the knowledge and then creatively use it and doing research and all the really the fun things that universities and colleges are for the young people to start their careers in life. But then there's the behind the scenes, that how does this all work? Well, you've got janitors and bookstores and the support services and secretaries and clerical stuff, the environmental people that clean and keep things running in your computer systems. So you're really trying to balance the business of making a successful learning environment, and then you've got the customers, the students out there that you're also responsible for. And certainly, I put in there this the extracurricular activities. There's going to be information about how to or when to and what kind of athletics. But also, there's the things your students do off campus. And this is one point I would advise you to do, is many of you know your students very well, and you know what they do off campus and where they tend to go. It's a great idea to contact those businesses and basically have that conversation that, we are partners in this. We know our students frequent your business, and we are here to help as a university. We're here to talk about how the students can interact outside of campus in a safe way. Again, you can't tell others what to do, but it's good to have that kind of dialogue. And the health department and others are good sources of advice on some businesses may need a little extra information, but it certainly lets them know that as a business, it's not just their business. Their business may impact others like the university. So if you see what I'm saying, it's good to have that kind of connection. And certainly, we certainly have heard a lot about wearing masks, and I think one advice is that you will be looking at what your policy will be and how you will enforce it on campus. Again, the masks in a healthcare environment, when we are seeing patients who are sick and they're potentially secreting lots of this virus, and we're doing things in the hospital down into the person's body that may bring the virus out even more, we're protecting ourselves with certain kinds of masks and eye protection, because this germ can get through the eyes too. And out in the community, the masks that you're seeing also protect you to some extent, but keep in mind, the mask is mainly to keep the person who's wearing it from infecting others. And it really helps contain the germs, but keep in mind, the germs are on the mask. And so handling the mask and not just using your bare hands and not washing them. So when you touch the mask, cleanse your hands after touching the mask. Keep it stored. We keep ours stored in a brown paper bag. Plastic tends to hold the moisture in a negative way. So we use paper bags to store the mask because, yeah, there could be germs in there. And if the supplies are limited, you're reusing the masks at times. But we know there's disadvantages. You know, you have to take into account that some people really are hard of hearing, or when you've got something on your face, you're constantly touching your face. Well, where are the germs? They're coming out of your nose and your mouth. And if you're touching, you're frequently contaminating your fingertips. And we know these masks don't last very long, and that's what we really stress with our team members in the hospital. Do not wear a mask that's ineffective. If it's torn, if it's overly moist, if it's got defects, if it's not protecting you, we need to find a way to be able to educate people on that, and hopefully with supplies, make sure they're replaced, that somebody is not using the same dirty mask over and over again, especially if that person had been in contact with somebody sick. That's just another source of infection. You know, a lot of you may not be involved in this, but I think it's good to keep an eye on what your teams are doing in different areas. Certainly, you're hearing about things that make you feel good, that there's extra cleaning and there's extra wiping down of surfaces. But, you know, keep in mind that your team is not missing some obvious things, because this is new to a lot of folks, that, for example, they're not using products that have expired. You know, the effectiveness of the germ being destroyed is an important aspect of it. And I will go back and mention that when you look at this germ, it is a very delicate germ that has a delicate coating around it. This is called the envelope, and it's made of fat and a little bit of protein. And because of that, this outer covering is easily destroyed by the everyday cleaning supplies we have and the hand sanitizers we use, and of course soap and water. Because if you start to disrupt this outer membrane, you disrupt these little things that are sticking out there, and it cannot bind to a body and lead to an infection. So that's very reassuring that it can be disrupted and destroyed. So using cleaning supplies is very effective. But I will make sure that not only are you using things that are not expired, if you are making your own, like your team might be taking bleach, which is by itself a little too strong, but if you dilute the bleach as recommended, and you'll find that on websites, keep in mind that once you make a mixture, it expires in 24 hours. So you may be hearing how you're using diluted bleach out there to clean surfaces, but then to find out that your team is actually using what is amount to just basically plain water if more than 24 hours have gone by. So it won't have that destroying capability. Also, you'll see everywhere these wipes, but make sure your team is understanding the instructions on each product. To kill certain germs, the surface has to remain wet after being in contact with the wipe. And it's the same thing with hand sanitizer. If you put hand sanitizer in the center of your palm and rub it around, but it dries out because you didn't have enough and your fingertips don't get wet, you're not killing any of the germs on your fingertips. So we've got to use enough to be wet long enough. And so when you see these little containers with the pop-ups and somebody didn't close the lid, that first wipe has dried out and is not going to destroy the germ. So just, this is something you can calmly put forward as a leader that shows that, you know, you're having everybody's best interest and you're looking out for them. Of course, you may see some injuries by people being over exuberant. They may be mixing bleach with ammonia, which some people don't know that creates a toxic cloud that can cause harm. Now, we also advise that you may have people working in particular places that they're sharing with other employees from shift to shift, and you want to have them wipe these things down after their shift, especially what they've touched, and also when the new person comes on, that they wipe what they're going to do. And of course, if they're fiddling with their face or blowing their nose or coughing, that's another opportunity to wipe things down that can be touched. You may have pens that people are using to fill out forms. Well, have a canister to put used pens in. And then as you know, again, ideas that I've observed in the community, a canister with clean pens, and that there's hand sanitizer, and that you ask people to do that. Keep in mind, I think everybody's reassured that you can't just tell them that you're doing a lot of things, showing them that you're doing it. So it may be repetitive, but wiping down surfaces in front of other people really helps reassure them. And if you're having cleaning staff go through the classrooms, you may want to, if you have enough staff, not have the same person clean the same area day after day. They'll do a good job, but human nature is they'll probably get 90% of what needs to be cleaned. And it'll be the same 90% day after day. If you're bringing a new person in there to clean a particular spot, they'll clean their own 90%, and you'll get this beneficial overlap because it won't be necessarily that they're cleaning the same surfaces, but I think that that's helpful also. Of course, time, as you've heard, this germ doesn't last a long time on surfaces, but on certain surfaces it can. Now we're going to touch on some difficult issues. One is, well, what if you do get a student or one of your team members sick and they tell you that they are tested positive, you know, that PCR test was positive and they have the illness. So in that case, when is it okay for them to come back? There are two methods. The first method has some problems to it, which I alluded to earlier, is that after the person has felt better, you can test them, and if they are negative, and then you wait 24 hours and test them again, and they're negative again, then the CDC says that this is okay to come back. But there's, excuse me, there's problems with that. Excuse me. The problem with that is, as I mentioned, the person may be non-infectious, but still shedding little pieces of non-infectious virus, but enough to make the test positive. And we've learned that people can be positive for up to a month after recovering from the illness. So this method becomes problematic for those individuals. It is hard to predict who's going to have that, who's that going to happen to. So the Centers for Disease Control has an alternative. It has changed over the last month, but the most current recommendation is once the illness has resolved and you've completely been fever-free, free of the symptoms that you had, like body aches and cough, for at least 3 days. So that's 3 days without fever and the symptoms are markedly improved for 3 days. Then you say, has it been 10 days since when you first got sick? If those two criteria are met, you can come back. So the soonest a person could come back to normal activity would be 10 days, as long as the last 3 days they've not had a fever or symptoms. We tend to use that definition. However, certain places like nursing homes will not accept a person back after their illness in most situations unless they've tested negative twice. We've seen some employers do that, but in most cases, the second option is followed and often recommended. But you'll often have a doctor who's seeing a patient personally and individually may tell the sick individual method number one. Well, you know, that's something you'd have to discuss with your health and health department and others, how you want to proceed. So much information out there, a lot's changing. There'll be new information and just remaining able to change directions, but be able to explain this with what Dr. Jackson had mentioned, frequent communication, letting people not be surprised. If you see something on the horizon, let folks know that, hey, we may have to change a particular event, or something that was planned on might not occur as planned. Just letting people know so they can prepare and not be surprised. So some questions that we have heard is, of course, you know, checking students for symptoms. So the problem is, when would you check for symptoms, and how do you do that efficiently? You know, you know, here at the hospital, when everybody walks into the building, we check them for symptoms and we measure their temperature. But you can imagine how challenging that would be at the beginning of every class, or there is no one entry point for people coming in at the beginning of the day in a college or university campus. So there's problems in trying to screen people coming into class. However, some of you may have that capability depending upon how you've staggered or limited the sizes of your class, or what responsibilities you want to give to those that are teaching classes. So you can look at those particular opportunities and what would work for you. But of course, you have to be ready for what if somebody tells you that they had a fever yesterday. Now remember, you can check somebody's temperature, but that's just that moment in time. If they had a fever that morning, that is very important, even if they didn't have a thermometer. So be very concerned about a person who tells you that they had fevers and chills last night and you measure their temperature and they don't have a temperature. I go by the, hey, we need more information because you telling me you had a fever. Do you have other symptoms and who have you been around? And we probably have to take precautions at that point, especially if they're coughing or having body aches with that fever that they reported. Now, testing students, this is going to be a big problem because the issue is that the test is only telling you information just for that very second. Granted, to test everybody and to say, well, at this moment, at least we know certain students aren't shedding the virus and didn't even know it. They didn't have any symptoms. It may have been because if they were positive, it may have been from an illness a month ago, and they're still, remember, still being positive, and they're not even contagious, or they could be getting sick tonight. But I'm much more worried about the student that tested negative, but 5-6 hours later, they're going to start shedding the virus, and a day later, they're going to start feeling sick. As you probably have heard, after you've been exposed to the germ, you're not contagious at that moment, but within somewhere between 2-5 days or so on average is the time it takes for you to incubate it and become sick. Now, to be on the safe side, you could develop the sickness up to 14 days after exposure. So you can test a person 3 days after exposure and it be negative. But 5 or 6 days later, they could start to be positive and they could get sick 7 days later and be obviously a problem at that point. So the testing, we're going to have big challenges if you move towards testing. And it's not just the testing, it's the supplies to do the testing, the availability of testing. How quickly are we going to get the results back? There's a lot of options out there, but there's also a lot of limitations and shortages. Things are not as easily available as we would like. And that leads me to recommending which students should you test? Let's start with the most easiest answer to that question. Test the people who are having sickness, that they have a fever, they have a cough, they meet those criteria, and the test, if positive or negative, is going to change what you're going to do. Early on at the hospital, we were not testing people because of limiting testing, but we also said the test wasn't going to change anything months ago. Months ago, we would just say to the person, you have a fever, you have a cough, you have a shortness of breath, but you're stable, you're otherwise healthy, you should go home and isolate yourself. And many of those patients did not get testing, but we made sure they stayed isolated until they were better. So again, a lot more is going to have to be discussed on that. Dr. Jackson touched upon the dining experience and how you can either stagger this or try to limit how close and together people are and the types of food you serve. You'll have students coming from other countries. Well, the argument can be made, coming from a particular country, how is that different coming from a city in the United States that has a high number of cases, and of course, coming from a family that has somebody ill in the family. Trying to get honest answers to questions of where have you been is helpful, but certainly a person coming from Brazil where there's an out of control outbreak is concerning, and there's going to be restrictions beyond the university that prevent people from traveling. But what if you have an international student? Yes, there may be a quarantine of which is what you do for a healthy person that's not having symptoms, but you felt they were exposed. That's a quarantine for up to 14 days to make sure that they don't have the symptoms. We have to work out the actual plans of where you would put this student. So how do you develop your quarantine will be a part of the planning. But the components, and so we can go through some of those questions and details. But again, enforcing a quarantine, that becomes a challenge too, if somebody doesn't obey it. Well, I can go to the next issue, is Dr. Jackson alluded to very seriously, what will you do? And you have to go through this right now. When you get 8 students that are not feeling well and their tests are being done and you're holding your breath wondering, you know, is this going to be a positive for COVID, or is it going to be influenza, or is it just going to be some other viral illness? Please take the opportunity that whenever even a small possibility occurs, you almost treat it like an exercise of the real thing. That just, what if this was a real situation? You can do it now, but it even becomes more effective as you're dealing with real people when the school year starts. But think about it now. You've got students in dorms, they have roommates. One is positive in one room, one is positive in another room. That's maybe 6 other people they've been in contact with. What will you do? Because the numbers can go up very quickly. You get 2 or 3 people who are friends on the same floor in a dormitory, and 2 or 3 of them are positive, and their roommates are not, but there's 16 roommates, or the entire floor. So the health department will be extremely helpful in that. But this is where you want to make sure you're prepared to fully cooperate with the health department. There will be an amount of time and information that's going to make their advice more valuable to you as you cooperate with them. So many of you have already done that for years. And so this is a great opportunity to continue strengthening that relationship. But you're going to have to deal with, you know, where and how do you have a student that is sick, and how do you keep them both if they're otherwise healthy and just been exposed, but keeping them engaged in classes with technology, or when they're mildly ill, how do you get food to them? How do you check on them to make sure they're not concerned? And of course, y'all are the experts in how to communicate with the parents, you know, with the student's permission, and be able to have everyone feel calm that you're able to handle these situations. So with that, I know I'll close with a couple things that Dr. Jackson had mentioned, but you're going to be also aware of what your students and your employees are doing outside of work, is to try to encourage them to be safe and not bring things into the workplace or back to the class. And also, we're finding this a major problem, is the second bullet here, is people are sometimes ignoring other serious medical conditions. Some of you may have already heard this, but if one of your team members, you know, can have stroke symptoms, heart attack symptoms, and they're concerned about not getting health care, we can assure you that coming to the hospital is a safe experience. I feel this is one of the safer places in the county, where we separate out immediately anyone who may have a respiratory issue versus anyone who may have a car crash, a broken bone, a heart attack, or a stroke. That their experience in getting that taken care of is very safe, and it's separated from any of the COVID issues. So do not delay, and keep emphasizing this to both your team members and your team members' families, that if you have staff that work for you, this is true for the community. Don't hesitate to get care. If you need 911, call 911. If it's a mild to moderate illness, get on the phone, communicate, and make sure they're getting care, because something may appear mild, but may actually be more severe, and the delay could be detrimental. I will echo the same thing about getting the flu vaccine. Strongly encourage this, as it can benefit both your team members and your students, and help reduce what is another basically epidemic that occurs every year. We don't need that on top of COVID. Be prepared, thinking ahead as a separate topic. How will you deal with the vaccine? You know, eventually this vaccine will become available. You will have to start to put in place, what are your plans to be a part of the distribution of the vaccine? So that will be coming. And I think you're going to be, like in forums like this, learning a lot from others. We'll be making mistakes. We'll be learning from those mistakes. I think you'll see some best practices, and we want to share those, especially if you know something that may help a community partner, a business that your students and team members use. Share that best practices. And you know, even though we're all wearing masks, underneath our masks, we're all trying to smile make sure we get through this. Thank you.
Perfect. Thank you both, Dr. Haight and Dr. Jackson. So a few questions have trickled in, and as we do the question and answer, I would encourage all attendees to just keep writing questions in the chat box. So the first question that we have here is just a clarification point. So do asymptomatic patients or persons, do they have a fever? Is there a way to do a screening with those patients that are asymptomatic to see if they're positive and to know the risks associated with them?
Well, I'll start off. Any asymptomatic person is, again, an entire person. You've got to look at, well, who is this person? Is there any clues if they were exposed, or if they came from a particular city? What were they doing in that city? I mean, if they were staying isolated in a particular city like New Orleans, where there might be a number of cases, they may be low risk. But if they honestly tell you about their activities, you may be able to assess the risk that they may have for an asymptomatic case. But it's right there in the word asymptomatic. They don't have any symptoms. They feel fine. There's nothing out of the ordinary. And so testing that person has, right off the bat, huge limitations and the chance for a false sense of security if you test them and they're negative. So that's one of our biggest problems. But do get to know the persons of why they may be wanting a test, or there's something they're worried about, and that they understand the limitations.
Perfect. So following up from that, should students be screened regularly with COVID-19 related medical questions?
Yeah, the related questions would be have you been having any fever? Have you been having any cough, any body aches? Have you lost the sense of taste, which is one of the unique things that people have mentioned? But all of these symptoms, they're not 100%. When you look at a person with real COVID, some of them don't have fevers. It's not until days or a week later that they may have fever. We're seeing people develop diarrhea or a belly pain. So there is a percentage of people that have each of these symptoms. So the screening questions brings us back to that original problem. When do you do that? What makes sense for your organization? And I have more to say on that, but Dr. Jackson, do you have any advice on that?
Yeah, additionally, we want to ask people, if we're going the way of screening, which I would advocate, we need to make sure that they've not been exposed to somebody in the prior 14 days that was COVID positive or had symptoms of COVID. I've heard that some universities around the world are limiting entrance doors into their buildings and having everybody come in and out through certain entrances so they can do screening. And that's really based on the physical layout of your building. But I am an advocate for screening, because if anything else, it reminds people to be cognizant of who they've been around and how they feel. To Dr. Haight's point, some people are completely asymptomatic, and it's estimated that 30 to 50% of people with COVID may be asymptomatic, and that can be a source of spread within a community. But we also know or feel that asymptomatic people probably shed less virus than somebody who is symptomatic. So if everyone wore masks, that would reduce the spread from people who are asymptomatic but still shedding.
Also, and I think we all probably have no surprise, a person can be completely dishonest about sharing that they have a high fever that morning and there's an alternative issue going on, because why would somebody not share with you? It may be that they don't understand what will happen. So you can try to limit that by letting people know there's no stigma, there are things we can do, we have a plan in place, you are in a safe place, we care about you if you're positive. Certainly how other countries have handled this have been somewhat different, but I think that you're going to have to deal with that. Plus, we've dealt with the person just failed to mention that they were tested 3 days ago and the result was available and it was positive, but they forgot to mention it, and that happens too. So just be forewarned about that. But yes, screening people and not letting the screening process be a nidus of infection, because if you funnel people into one spot, you know, you want to make sure that you're controlling the spread so that people are wearing masks and they're still remaining socially distant, and that you're protecting the person who is also doing the screening questions.
Thank you. This next question is for Dr. Jackson. What is the best way for universities to report cases of COVID-19?
So if you all sort of catch wind that there may be some people that are symptomatic, by all means, I'd like you to call my EPI department, and I have the number on the slide that's part of the slide deck. So again, when somebody develops COVID and gets diagnosed, we may know about it before you do. On the other hand, you may know about it before we do. So the communication together is important.
I do see a question on my chat box about suggestions for nursing students. Certainly we have, we have concerns about nursing students who are getting their education in the past in nursing homes. Opportunities to learn there, but this is not the place to go into lightly because of the number of infections in nursing homes. And we are seeing people who work at nursing homes have infections. So people being very careful of that. But each hospital is working with each school to make sure that the nursing education experience, which is helping keep people active in this much needed heroic profession, ongoing. And so each hospital is working with the nursing students. So athletes is more of a challenge because of the closeness of most athletic events and the inability to safely move forward with a lot of reassurance. As athletics conversations occur, I would urge that everyone try to follow the same standards when the time is right, like after the vaccine has been developed. By following the same standards, if something does go wrong, it's a little easier to sort out how you can make an improvement. But if everybody's doing their own little rules on how they're keeping their athletes healthy and contacts and training and all that, it becomes more chaotic if things don't turn out too well, and harder to give advice on to fix it. So there's going to be more to come on athletics. I might be able to answer specific questions for nursing students in athletics, but that's one of the chat questions there.
Thank you. Another question that came in was, if a student is sick or a group of students do become ill, would you recommend that those students be removed from the university and placed into a facility that, let's say, like the city provides to hold them until they are better to return to campus?
I'll take that one. And I think part of your plan should be, what do you do with students that develop symptoms? And that's going to be unique to your institution, unique to that student. If you have a student that's a commuter student, then obviously they should go home. So isolation from the rest of the campus is important, but how you do that, to my knowledge, neither the cities or the counties have the ability to house students at this point. I mean, if you want to reach out to them, fine, but I wouldn't, I think that would probably be unlikely. So, you're going to need to work with your team to see how you can arrange safe housing for students.
Guys, we were reading some of the questions that were submitted from many of you, and as I read those questions and tried to imagine myself as responsible at a university and as an administrator, yeah, I can feel the panic attack. Is that these are tough questions, and when you move through these questions of, well, what if you did get 8 students that needed to be separated from others, and you have to be able to be transparent and able to let the general parents and other students know how you're handling it, being able to walk through all that and how you would communicate while also doing what Dr. Jackson emphasized is in respecting people's privacy. Certainly public health trumps privacy in many areas, but you want to respect people's ability to go forward and be able to deal with this disease, which is similar to other diseases, but here we are having this special circumstance.
Perfect. Thank you. So at this time, that's the last question that we've received through the chat box. So I'm going to go ahead and pass it over to Kim, and she can wrap up, or if Dr. Haight or Dr. Jackson have any closing remarks, feel free to do so.
Yeah, I'd like to.
Go ahead. So generally, feel free to give us a call, email us. Also, in Lakeland, we do have our respiratory care center, which is helping patients that have some new breathing problem that is not necessarily needing an emergency room. That's located in Lakeland near the Southgate Mall. It's on Pablo Street, and they provide an assessment to see if this could even be COVID or another type of illness, whether or not testing is needed, and do have some diagnostics such as X-ray and examination. There's also a drive-through testing that's currently at the RP Funding Center, which is the Civic Center there in Lakeland, and you call ahead for that. And you can find this on our website, mylrh.org, and there you can either bring in a prescription for testing or find that there is a number you can call to get a telemedicine evaluation over the phone with a physician or clinician, and to see if testing is necessary, and then that can be done in sort of a drive-up process. And that may be helpful for some of your team members. Of course, many of the college and university campuses do have their own health operation, and you'll be working within those to determine how best to deal with students and staff that are sick. Thanks.
My comments is I look forward to working with each of you as we go forward and as you create your planning documents and you consider different scenarios. I think from the health department standpoint, I would really like to have conversations with you about contact tracing. That's what keeps me awake at night, is having you have a case or an outbreak and we're not communicating well. So I would like to have you reach out to me, and I can involve my EPI lead, Dr. Daniluk, and we can have discussions about how do we deal with this going forward. So look forward to working with each of you. Thank you.
Thank you both. So we'll go ahead and send it on over to Kim for closing remarks.
Again, thank you to each and every one of you for attending today. We want to encourage close collaboration as we move through this now normal environment. Both Drs. Jackson and Haight have made themselves very available, but if you would continue to find it valuable for us to all be on the line together, we will continue to offer a convening in a group setting like this. If there are no more questions currently in the chat box, we would wish you all a healthy and safe day and immediate future moving into your planning documents for your campuses. Thank you very much.